The fluorescent lights of St. Catherine's Hospital Emergency Department hummed their endless mechanical song as Marcus Reed stood at the nurse's station, his orange scrubs slightly wrinkled from a 12-hour shift that had somehow stretched into hour 14. His hands moved with practiced efficiency across the keyboard, updating patient charts while simultaneously keeping one eye on the waiting room monitor. But it wasn't the medical emergencies that made his shoulders tight with tension tonight. It was the whispers, the barely concealed snickers, the pointed looks from Dr. Vanessa Hartley and her small circle of admirers who seemed to find endless amusement in his very existence. Marcus had grown accustomed to being underestimated. At 34, he was one of only 3 male nurses in the entire emergency department, and the only single father juggling split shifts to accommodate school pickups and homework help and parent-teacher conferences. His daughter, Zara, was 8 years old, brilliant and beautiful, with her mother's dark curls and his own stubborn determination. When his wife, Clarissa, had died 3 years ago in a car accident, Marcus had made a choice that surprised everyone who knew him. He'd left his high-pressure job in hospital administration, enrolled in an accelerated nursing program, and rebuilt his entire life around being present for his daughter. Not everyone understood that choice. Some, like Dr. Hartley, seemed to view it as evidence of failed ambition, a man who couldn't hack it in the real world of medical hierarchy. "Oh, Marcus," Dr. Hartley's voice dripped with false sweetness as she approached the station, her designer heels clicking against the linoleum. "Still here? Don't you have some cartoon to watch with your kid or something?" Her companions, 2 younger residents trying to curry favor, laughed a bit too loudly at the jab. Marcus didn't look up from his computer screen. He'd learned that engaging only fed the beast. "Just finishing my documentation, Dr. Hartley. Patient in room 7 needs their discharge papers signed when you have a moment." She leaned against the counter, her perfume overwhelming in the recycled air. "You know, I was just telling Dr. Chen that it's so admirable how you've made peace with your limitations. Not everyone has what it takes for medical school, and there's absolutely no shame in that. We need good nurses. Well, adequate ones at least." The barb landed as intended, but Marcus kept his expression neutral. This wasn't new. What Dr. Hartley didn't know, what none of them knew, was that Marcus had been accepted to medical school before Clarissa died. He'd deferred his admission twice, then finally withdrawn it completely when he realized that becoming a doctor would mean even less time with Zara, more nights away, more missed moments of her childhood that he could never recover. The evening continued its grinding pace. A teenager with a skateboard injury, an elderly man with chest pains, a young mother with a colicky infant, exhausted beyond words. Marcus moved through each case with quiet competence, his bedside manner earning grateful smiles from patients even as some of his colleagues rolled their eyes at his thoroughness. He just finished helping transport a patient to radiology when his phone buzzed with a text from his neighbor, Mrs. Chen. She watched Zara on his late nights, a kindness he could never fully repay. "Zara's asleep. Don't rush. She did great on her math test, 98%. You're raising an amazing girl, Marcus." The message made his chest tight with pride and longing. He missed tucking her in, missed their bedtime ritual of reading together, her head heavy against his shoulder as they journeyed through whatever fantasy world she'd chosen that week. "Incoming trauma!" The announcement crackled through the overhead speakers, snapping Marcus back to the present. "Military personnel, critical condition, ETA 3 minutes." The emergency department transformed instantly into controlled chaos. Dr. Hartley took command, barking orders, positioning staff. Marcus moved to the trauma bay, pulling on fresh gloves, checking equipment. This was what he loved about nursing, these moments when everything else fell away and only the mission mattered. Save the life in front of you. Nothing else existed. The ambulance screeched to a halt outside, and the paramedics burst through the doors with a stretcher bearing a man in desert camouflage, his uniform dark with blood. Lieutenant Commander Jackson Hayes, United States Navy SEAL. The lead paramedic rattled off vitals as they transferred him to the trauma bed. IED explosion during training exercise, multiple shrapnel wounds, suspected internal bleeding, BP dropping. But Marcus had already stopped listening to the clinical details. He was staring at the man's face, half obscured by an oxygen mask, and his world tilted sideways. It couldn't be, after all these years. But those features were unmistakable, even beneath the dirt and blood and pain-glazed confusion. "I've got this," Marcus said, his voice steady despite the storm in his chest. Jackson, can you hear me? It's Marcus. Marcus Reed. Stay with me, brother." The SEAL's eyes flickered, consciousness wavering. His lips moved behind the oxygen mask. "Reed? That you?" His voice was barely a whisper. "Yeah, it's me. You're at St. Catherine's. We've got you. You're going to be fine." Marcus's hands moved with absolute precision, starting IVs, monitoring vitals, cutting away uniform to expose wounds. 12 years. It had been 12 years since they'd last seen each other, since they'd served together in the Navy, since Jackson had quite literally saved Marcus's life during their deployment in Afghanistan. They'd been corpsmen together, brothers forged in the crucible of war. Jackson had been the one who'd talked Marcus through the worst nights, who'd understood the weight of holding dying men in your arms, who'd made Marcus promise that if they both made it home, they'd live lives that honored those who hadn't. Dr. Hartley was issuing rapid-fire orders, but Marcus saw what she was missing. The pattern of wounds, the way Jackson's breathing had changed in the last 30 seconds. "Doctor, we need to get him to surgery now. I think there's damage to the liver, possibly the spleen. This bleeding pattern—" "I'll assess the situation, Nurse Reed." Dr. Hartley cut him off sharply. "Continue monitoring vitals and let the doctors do the diagnostic work." "With respect, doctor, I've seen these injuries before. In combat, if we wait for imaging—" "Are you seriously questioning my judgment right now?" Her voice rose, sharp enough to cut through the organized chaos. "Your job is to follow orders, not play doctor because you watch medical dramas at home with your kid." The room went silent, except for the monitor's insistent beeping. Marcus felt the eyes on him, the judgment, the assumption that he was overstepping, that he couldn't possibly know better than the doctor with her prestigious credentials and her absolute certainty. But this wasn't about ego. This was Jackson. This was his brother. And he knew, with the certainty that came from watching men die from exactly these injuries, that they were running out of time. "Get him to CT now," Dr. Hartley ordered. "We'll do a full scan series before making any surgical decisions." Marcus looked down at Jackson, saw his friend's skin going gray, saw the way his body was starting to shut down. He made a choice in that moment that he knew might cost him his job, might end his career, but that was the only choice his conscience would allow. "Jackson, I need you to stay conscious. Can you do that for me? Remember Helmand Province. Remember you told me we don't give up. So, don't you give up now." He turned to Dr. Hartley, his voice calm but unyielding. "I'm requesting that you call for a surgical consult immediately. This patient is critical, and in my professional judgment, imaging will waste time we don't have." The fury in Dr. Hartley's eyes could have melted steel. "Your professional judgment? You're a nurse, Reed. Your professional judgment extends to following my orders. Now step back and let me do my job, or I'll have you removed from this case and written up for insubordination." Marcus felt the weight of the moment pressing down on him. His job, his livelihood, everything he'd built for Zara. But he looked at Jackson, saw his friend's hand reaching weakly toward him, and he knew he couldn't back down. Not when a life hung in the balance. Not when that life belonged to someone who'd once carried Marcus on his back for 3 miles through hostile territory with a bullet in his own shoulder. The doors to the trauma bay burst open, and Dr. Richard Chen, the chief of surgery, strode in with his characteristic intensity. "What's the holdup? I heard we had a critical military trauma." "We're preparing for imaging," Dr. Hartley began, but Dr. Chen was already at the bedside, his experienced eyes taking in what Marcus had seen immediately. "No time. This man needs surgery 5 minutes ago. Prep or 3. I want blood ready. Full surgical team, now." He glanced at Marcus. "Good catch, Reed. You probably just saved his life by pushing for urgency." The vindication was cold comfort as they rushed Jackson toward the operating room. Marcus followed as far as he could, squeezing his friend's hand once before the surgical doors closed between them. "Fight, Jackson. Like you taught me to fight. Your story isn't over." The next hours were a blur of continuing his shift, managing other patients, fielding Dr. Hartley's icy glares and pointed comments to anyone who would listen about nurses who didn't know their place. Marcus endured it all with the quiet dignity he'd learned from his father, a postal worker who'd faced his own share of disrespect and discrimination, but had always maintained that you couldn't control how others treated you, only how you responded. It was nearly midnight when Marcus finally made it to the surgical floor, still in his scrubs, exhaustion pulling at every muscle. Jackson was out of surgery, stable but critical. Dr. Chen had removed his spleen, repaired damage to his liver and right kidney, and extracted 17 pieces of shrapnel from his torso and legs. He'd live, but it had been close. Marcus stood outside the ICU room, watching through the window as Jackson slept, connected to a maze of tubes and monitors. A nurse he didn't recognize approached him, her expression curious. "Are you family?" "Something like that," Marcus said softly. "We served together." "He's lucky you were here," she said. "Dr. Chen told us that another 20 minutes and the internal bleeding would have been catastrophic." Marcus nodded, too tired for words. He should go home. Zara would be wondering where he was when she woke for school. Mrs. Chen would need to leave. But he couldn't quite make himself walk away from Jackson. Not yet. Not when they'd only just found each other again after all these years. The next morning, Marcus returned after dropping Zara at school. His daughter's questions about why he looked so tired and why he seemed so worried still echoing in his mind. He'd told her the truth, or a version of it, that an old friend had been hurt and that sometimes being there for people we care about means being tired for a while. She'd hugged him extra tight, this wise little soul who understood more about sacrifice than any 8-year-old should. Jackson was awake when Marcus entered the ICU room, his eyes clear but pain-tight. "You look terrible, Reed," Jackson croaked out, managing a weak smile. "You look worse, Hayes, but alive, so I'll take it." Marcus pulled up a chair beside the bed. "How long has it been? 10 years? 12? 12? Since we mustered out?" Jackson's gaze was sharp despite the pain medications. "I heard you. Last night, when I was going under, you said my story wasn't over." He paused. "Yours isn't either, brother. I heard some of what that doctor said to you, the disrespect. That's not right." Marcus shrugged, uncomfortable with the topic. "It's fine. I can handle it." "Can you? Should you have to?" Jackson's intensity hadn't dimmed with injury. "The Marcus Reed I knew in the service was one of the best corpsmen I ever worked with. Smarter than half the doctors, braver than most of the officers." What happened? So Marcus told him. About Clarissa. About Zara. About the choice to become a nurse instead of a doctor. The choice to prioritize being present over prestige. The daily reality of being a single father in a profession and a hospital system that sometimes seemed designed to make him feel small. Jackson listened, his jaw tight with anger on Marcus's behalf. "You made the right choice," he said finally. "Being there for your daughter. That's what matters. But that doesn't mean you should be treated like you're less than. You saved my life last night, Marcus. You saw what that doctor missed, and you had the courage to push back even when it could have cost you your job. That's not just skill. That's character." The conversation was interrupted by a commotion in the hallway, raised voices and official-sounding inquiries. A moment later, 2 men in Navy uniforms appeared at the door, a commander and a senior chief, both with the hard-edged competence that marked career military. "Lieutenant Commander Hayes," the commander said, his voice formal but warm. "Good to see you awake, sir. We've been worried." Jackson gestured toward Marcus. "Commander, Senior Chief, this is Marcus Reed. He's former Navy, served as a corpsman in Afghanistan. We deployed together. He's also the nurse who saved my life last night when I came in. If he hadn't recognized the severity of my injuries and pushed for immediate surgery, I wouldn't be talking to you right now. The two officers studied Marcus with new interest, and he suddenly felt very aware of his wrinkled scrubs and the coffee stain on his sleeve from his rushed breakfast with Zara. "Former hospital corpsman second-class Marcus Reed?" the senior chief asked, pulling out a tablet and scrolling through information. "Served with distinction, multiple commendations, Navy and Marine Corps Achievement Medal for your actions during the Battle of Marja?" Marcus nodded, surprised they'd pulled his record so quickly. "Yes, Senior Chief, but that was a long time ago." "Service like that doesn't get old," the commander said firmly. "Neither does loyalty. The lieutenant commander here is part of our SEAL team family. When we heard what happened, when we heard how you advocated for him even at personal and professional risk, we knew we needed to come thank you personally." Jackson smiled, the expression taking years off his pain-drawn face. "I may have made a few calls from my hospital bed this morning. See, the thing about the SEAL community is we take care of our own, and we don't forget the people who have our backs." The implications of that statement were still sinking in when Dr. Hartley appeared in the doorway, her expression shifting rapidly from annoyance at finding Marcus in a patient's room to confusion at the military presence to something approaching alarm as she took in the insignia and bearing of Jackson's visitors. "I'm Dr. Vanessa Hartley," she said, recovering her composure with visible effort. "I was the attending physician when Lieutenant Commander Hayes arrived. If you have questions about his medical care—" "Actually, Doctor," the commander interrupted, his tone polite, but with an edge that suggested he suffered fools poorly. "We're here primarily to speak with Nurse Reed. Our understanding is that he was the medical professional who recognized the critical nature of the lieutenant commander's injuries and pushed for immediate surgical intervention despite, shall we say, institutional resistance." The color drained from Dr. Hartley's face. "I'm sure there's been some misunderstanding. Medical decisions in an emergency department are complex, and while nurses certainly play a valuable support role—" "There's no misunderstanding," Jackson said, his voice carrying command authority despite his weakened state. "I was conscious enough last night to hear everything. I heard Nurse Reed correctly identify my injuries. I heard him request immediate surgical consultation. And I heard him be dismissed and belittled for doing his job with the kind of expertise that comes from saving lives under combat conditions." The silence that followed was arctic. Dr. Hartley's mouth opened and closed, but no words emerged. The commander's expression had gone from professionally courteous to glacially disapproving. "I see," he said finally. "That's disappointing to hear. The lieutenant commander is not just a valued member of the naval special warfare community. He's my friend, someone I've served alongside for 8 years. Knowing that his life was potentially put at risk because qualified medical input was dismissed due to, what, professional hierarchy? Status concerns? That troubles me deeply." The senior chief stepped forward, addressing Marcus directly. "Petty Officer Reed, on behalf of the United States Navy and Naval Special Warfare Command, we want to extend our formal gratitude for your actions last night. You embodied the very best traditions of the hospital corpsman rating, and you honored your oath to preserve life above all other considerations. That takes courage, especially when there are personal costs involved." "It was just the right thing to do," Marcus said, uncomfortable with the attention but grateful for Jackson's intervention, understanding now what his friend had meant about the SEAL community taking care of their own. "The lieutenant commander would have done the same for me. He did, actually, in Afghanistan, more than once. Which is why we take these things seriously," the commander said. He turned to Dr. Hartley, his expression professionally neutral, but his eyes hard. "Doctor, I believe we need to have a conversation with your hospital administration about protocols and the importance of listening to all qualified medical professionals, regardless of their role in the hierarchy. Would you be so kind as to direct us to your Chief of Staff's office? If this story is touching your heart, if you believe in standing up for what's right even when it costs us, please leave a like and share this video. Your engagement helps these stories reach people who need to hear them. And if you've ever been underestimated or dismissed, drop a comment telling us how you overcame it. Your stories inspire us all. The next hours unfolded with the kind of inevitable momentum that Marcus had only seen in movies. Hospital administrators appeared, first defensive, then increasingly concerned as they realized they were dealing not just with complaints, but with potential legal and public relations implications of a physician's dismissal of potentially life-saving medical input from a decorated veteran. Dr. Chen, the surgeon who'd operated on Jackson, added his professional assessment that Marcus's rapid identification of the injuries had indeed been critical to saving the patient's life. By afternoon, Marcus found himself in an unexpected meeting with the hospital's chief of staff, a stern woman named Dr. Patricia Morrison, who'd built her reputation on running a tight ship, but who also, it turned out, had a son who'd served as a Marine in Iraq. "Mr. Reed," she said, gesturing for him to sit in her office. "I've spent the morning reviewing the events of last night, and I owe you both an apology and my gratitude. Your quick thinking and willingness to advocate for your patient, even at potential personal cost, represents exactly the kind of nursing excellence we should be celebrating, not suppressing." She paused, her expression grave. "I've also learned that last night was not an isolated incident, that you've faced ongoing disparagement and professional disrespect, particularly from Dr. Hartley. That ends now. We're implementing immediate changes to our emergency department protocols to ensure that all clinical input is heard and evaluated on its merits, not dismissed based on hierarchy, and we're conducting a comprehensive review of our workplace culture to address any patterns of discrimination or harassment." Marcus listened, part of him grateful, part of him simply exhausted. "I appreciate that, Dr. Morrison, really, but I don't want anyone to lose their job over this. I just want to do my work, take care of my patients, and get home to my daughter." Dr. Morrison's expression softened. "Your file tells quite a story, Mr. Reed. Decorated Navy veteran, widowed young father, gave up a career path in administration to become a hands-on nurse so you could have a more flexible schedule for your daughter. Consistently exemplary performance reviews, multiple patient commendations. You're exactly the kind of medical professional we should be supporting and promoting, not tolerating abuse of." She leaned forward. "How would you feel about taking on a leadership role? We've been looking for someone to head up our emergency department nursing education and protocol development. It would mean better hours, better pay, and a chance to shape how we train the next generation of nurses. You'd still get to work clinically, but you'd also have the authority to ensure that what happened to you doesn't happen to others." The offer stunned him. It was more than he'd imagined, more than seemed possible after years of just keeping his head down and surviving. "I need to think about it," he managed. "Talk to my daughter. She's the reason I do all of this." "Of course, take the time you need. But Marcus? We'd be lucky to have you in that role." That evening, Marcus sat at his kitchen table with Zara, her homework spread between them, and tried to explain the strange turn his life had taken. "So, your friend from the Navy came to the hospital, and he was hurt, but you helped him, and now people are being nicer to you at work?" Zara's summary cut through all the complexity to the simple truth. "Something like that, sweetheart. And they offered me a new job, a better one. But it would mean some changes for us. Different hours, maybe. More responsibility?" Zara looked at him with those dark, serious eyes that reminded him so much of Clarissa. "Would you be happy, Daddy?" The question undid him. When had he stopped thinking about happiness as a goal? When had he started measuring his life only in terms of survival, of getting through each day, of meeting the minimum requirements to be an adequate father and an adequate nurse? "I don't know, baby. Maybe. I think so." "Then you should do it," she said with 8-year-old certainty. "Mommy would want you to be happy. She told me before she died. She said to make sure you don't forget how to smile." The tears came then, unexpected and overwhelming, and Zara climbed into his lap the way she had when she was smaller, her thin arms around his neck. "It's okay to cry, Daddy. You tell me that all the time. It's okay to feel things." The next day, Marcus returned to the hospital to find Jackson sitting up in bed, looking remarkably better for someone who'd been at death's door 48 hours earlier. The resilience of SEALs was legendary, but seeing it in person still amazed him. "I hear you're basically famous now," Jackson said with a grin. "The nurse who stood up to Dr. Evil and lived to tell the tale?" "Dr. Hartley's not evil," Marcus said, though the defense lacked conviction. "Just difficult. She's on administrative leave pending a full investigation into multiple complaints that mysteriously surfaced once people realized they could speak up safely," Jackson said. "Turns out you weren't the only one she's been making miserable. People just needed to see someone stand up first." He gestured for Marcus to sit. "You know what the real difference is between us and them? Between the people who've served in combat and the people who haven't? It's not courage, exactly. Plenty of people who've never worn a uniform are brave. It's that we learned the hard way that rank doesn't equal wisdom, that life and death decisions don't care about hierarchy, that sometimes the person with the clearest view of the situation is the one willing to speak up even when everyone else is looking the other way." He paused. "You did that last night, Marcus. You saw what needed to be seen, and you said what needed to be said. And yeah, you might have lost your job, but you would have kept your integrity. That's the trade-off people like us understand. Please comment if you've ever had to make a difficult choice between doing what's right and protecting yourself. We want to hear your stories." Marcus spent the next week in a strange liminal space, working his regular shifts while the hospital conducted its investigations and reorganizations, watching as the culture of the emergency department began to shift almost imperceptibly. Dr. Chen started asking for nursing input during rounds. Other physicians, emboldened by the administrative support for collaborative care, began actually listening when nurses raised concerns. It wasn't a revolution, but it was something. Jackson recovered with remarkable speed, proving that SEAL resilience wasn't just propaganda. He'd be medically retired from active duty, but he was already talking about consulting work, about using his experience to train the next generation. On his last day at St. Catherine's before transferring to the Navy's Medical Center for long-term rehabilitation, he called Marcus to his room. "I've got something for you," Jackson said, pulling out a small velvet box. Inside was a Navy SEAL trident pin. "I can't wear this anymore, not officially. Medical retirement. But I want you to have it, not as decoration, but as a reminder. You're still one of us, Reed. Still a warrior, even if your battlefield is different now. Still someone who runs toward danger instead of away from it. Still someone who puts others before yourself." Marcus held the pin, feeling the weight of it, the meaning. "I can't accept this, Jackson. You earned this. And now I'm giving it to you because you earned it too, in your own way. Every shift where you show up tired because you were up all night with a sick kid, but you still give your patients everything you've got. Every time you stand up for what's right, even when it costs you. Every moment you choose to be present instead of important. That's service, brother. That's the kind of courage that matters."